Hello everyone, I'm Yao Boache, and I'm urging you all to subscribe to Nate Calvin's channel. Don't forget to like, comment, and share. Thank you.
Hello! Please subscribe!
Hi guys, my name is Amoji Joe. You're welcome to Nate Calvin TV. Guys, today I want us to talk about how to write a proper nursing care plan. Care plan can be a bit difficult, or is very difficult and confusing for a lot of students, which I was once a victim, just to understand what the nursing care plan is and how to go about the nursing care plan. So today I'm here to help you, to also let you understand how the nursing care plan works, how to understand each and everything on the nursing care plan. So today I'm here with the nursing care plan, and this nursing care plan sheet is the nursing care plan that we use in Ghana. It varies according to countries. So every country has its own nursing care plan, and the way it has been structured is different from the way Ghana's one is being structured. This one is for Ghana. Yeah, this one is Ghana's nursing care plan sheet. So guys, when we look at this nursing care plan, the front page contains the patient information. So when you look at the top here, you can see we have the name, we have the inpatient number, we have occupation, we have name of physician. Then when you come here, we have the patient problems, the allergies, the patient strengths. Then when you come here, we also talk about the routine care. So here is the front page of the nursing care plan. Here is the front page of the nursing care plan. Then when you come to the middle, so all this place contain, or this place will give you only 6 marks. But students will waste their time here instead of them focusing on the middle page, which is going to give them a lot of marks. So students waste a lot of time because if you fill the patient information and everything, you get only 1 mark. Then the patient problem will give you 2 marks. Then the patient strength will give you 1 mark. Then the routine care will give you 2 marks, which is making it 6 marks. So here will give you only 6 marks. But when you come here in the middle here, you have what? The nursing diagnosis, then you have the objective or the outcome criteria. So here will give you 12 good marks. So here and here will give you 12 good marks. Then the back here, which will be talking about the medication, other treatment and investigation, will give you only 2 marks, which is making it 20 marks. So guys, without wasting my time, let's go on and know how to write a proper nursing care plan. When we talk of care plan is a document, or is a structured document that outlines the nursing diagnosis, the goal, the nursing intervention and evaluation that provide an individualized and effective patient care. Individualized and effective patient care. So that's what you need to understand. So when you write this nursing care plan and you're able to write it properly, you'll be able to give a proper care to a patient, because you get to know about what is wrong with the patient, what is going on with the patient. Then you know how to go about your routine care for the patient. So guys, don't forget to subscribe, turn on the post notification, so that anytime we do a video on this channel, you'll be the first to watch. Guys, please, this will be the part 1 of the video we are going to record about nursing care plan. I want you to understand. So today we are going to be working on the front page of the nursing care plan. So now let's start with the front page of the nursing care plan. So the front page, which is the nursing care plan, we have the name. So here you provide the patient details, which you can get it on the patient medical sheet, or you can get it from your records book, which will contain the patient. Maybe the patient name is Papa Kwasimanu, so you write Papa Kwasimanu here. Then you come here, you have the inpatient number. So when you go to every hospital, the patient will be given a number or a card which will contain a number on it. So you write it here, which is the inpatient number. Then when you come here, we have the occupation. It means the work that the person does, what the person is into. So Papa Kosimano is a teacher, so you write it here, teacher. Then we have the name of physician. So the name of physician means the doctor or the physician which is taking care of the patient. Then when we come here, we have the date of admission, the date that the patient was being admitted into the ward or the hospital. Then when we come here, we have the ward. So maybe the patient is in the male ward, the pediatric ward, the labor ward, or wherever. Then we have the bed number, whether bed 10, bed 5, bed 7, or bed whatever. Then we have the religion. So when we talk of the religion is talking about the patient, whether he's a Muslim, he's a traditionalist, or whatever. Then we write the patient's age. Then we have the diagnosis. So here, this diagnosis is talking about what the doctor, the condition that the doctor has diagnosed the patient with. Being it, maybe the patient is being diagnosed of ascites, maybe the patient is being diagnosed of peptic ulcer, or the patient is being diagnosed of maybe gastritis or whatever. So here is where you write the diagnosis of the patient. Then we have the date of discharge. So when the patient has not been discharged yet, here you write not yet. You write not yet. So if the patient has been discharged, you state the date. You write the date here. Then let's come here. When you come to the patient problem, the patient problem is very important, and the reason why it is very important is the patient problem is the main reason why you are writing this nursing care plan. And it is through the patient problem that you'll be able to also deduce, or you'll be able to write your nursing diagnosis. Because if you are not able to get a proper problem or patient problem, you won't be able to write a proper nursing diagnosis. And that's one of the major reasons why we find it difficult to write a nursing care plan, because a lot of students will go to the ward or go to the exams or fully prepared. When I say fully prepared, like at the end of what deep nursing care plan will be about if you feel a day. So Okuduna and the patient said, please use this patient to write a nursing care plan. That will be a problem. And also for you to get the patient problem, a lot of us will walk to the patient. So Dr. Khan, a lot of us will walk to the patient. So let's see, this is the patient that I'm using for the nursing care plan. So this is the patient I'm using for the nursing care plan. So I will walk to the patient. Then we will do a mommy, here. Now, and there will problem the same. So you see, the way I ask the person, this one, we don't get, because you don't know what I'm talking about in it. He won't understand what I'm trying to say. But let me try to tell you something. If you want to get the proper nursing, tell you their problems. So sometimes you need to do your own assessment, and sometimes maybe the patient is unconscious, or the patient is unconscious, and I am giving to you for you to write a care plan on the patient. So you need to do your own assessment and know the condition that the patient is in. Then you write your nursing care plan. So let's see, say the patient will, there's any condition here, maybe gastritis, and I say maybe a condition be a peptic ulcer. Then a nipanite. So nipanite and peptic ulcer, you know, so definitely the first thing I'm nipanite to complain of, then be a patient that complains of what? Of acute pain. So what else here? So you write that one here, acute pain. So then maybe the patient will complain of what? Nausea and vomit. So then you write the nausea and vomit near them. Then you, your own assessment, you may see, say, okay, the patient, is not able to cooperate with the treatment. Then you state that one here. Then you can see, say, maybe the patient is in anxiety. Then you write that one and say the patient is what? Is in what? Anxiety. So you write maybe the patient complain of acute pain, and the patient complain of what? Of pain. So when I then patient complain of nausea and vomit. So when I Then patient complain of loss of appetite. So these problems now make the team one and no na eye adie na what they care plan. But any eye problem now yes we are fine. And people will write problems now people are facing now. Then when the person gets to the nursing diagnosis now, now what make different thing. That's the reason why it's here. We see patients complaining here of acute complaining of pain. And the pain, no, then you diagnose it. So how do you diagnose patients that they are all pain? And as how do you diagnose patients that one can complain as all pain? So that would be the you write maybe acute pain. So say you have any money or peptic ulcer, then you write maybe acute pain related to acute pain related to irritation or inflammation process in the stomach or the abdomen. So that one I'm going to say the person is having a peptic ulcer and I'm complaining to you say she or she is having what pains in the stomach. So when you are using or when you want to get the nursing diagnosis, now you can also write acute pain related to inflammation process or irritation in the stomach. Because when we take peptic ulcer area, when there is a lot of secretion of the acidic contents in the stomach, so you based on the same problems and now the back the nursing diagnosis. So in the part 2, this one I just want you to understand the in the part 2, you write it together. The one after the other, one after the other. Then you all will get the understanding on how to write a proper nursing care plan. Into one patient the problem no nursing what diagnose. Then you use the nursing diagnosis to write the nursing intervention. The people complain is he or she is having what pain in the stomach. What are you going to do for the patient now or have his pain? So that will be where now we try the nursing intervention. The nursing intervention for pain, maybe you need to assess the pain by using what the pain scale to check the severity of the pain and all those stuff. So what I say, yes. So when we start then you come to allergies. When we talk of the allergies now, we talk about the person is allergic to. Be one man, the person is allergic to IV fluids. Maybe the person is what allergic to maybe cannulization. So you need to indicate. It's a different here allergic to that man, then you indicate. Say the person is what allergic to this or that. If the person is not allergic to anything, then you write say no known allergies. No known allergies. Guys, we are what I'm trying to say. So we follow. Yes. So what's your saying? Yes, so when we start to write, you get to understand everything perfectly. Now, I just want to give you the overview for you to know how the nursing care plan works. Then, let's continue. So when we come here, we have the patient strength. So the patient strength, are the things now the patient can do for herself. So I'm going to the things that patient can do whilst the patient is in the ward. Nearma with me and to be another patient not complaining of stomach ache, but the patient can move in bed. Maybe patient can move in bed. Patient is able to take, maybe you are complaining of loss of appetite. A patient can take in his or her favorite food when given in bed. So all these the strength of the patient. So what I say, so the patient's strength, and yes, the thing that the patient can do for herself. That one too, the patient can tell you, and you yourself too can also assess or observe to also know. Then when you want to get a patient problem now, there are a problem, and I say there are you're finding the difficult, and I say a problem. When we want to get out, we will go through your mommy, but now the problem you see, sir. Yes, on view. You need to be polite, you need to be respectful, then you need to have a conversation with the patient. Obu honor on state problem in my street, but you get to know. Maybe I obviously but only made him come up. Or say, oh, Emma man there or what to say, and all that thing when he what did he, and they say, it's true that you get to know the the patient because oh, be a ban rap and to me and you, and you know the problem in a way when to me and when your problem means that the patient don't have that problem when it comes to appetite. Then you can state that one. Maybe I'm about no TV, no so see so no. Then you know, so the patient is having difficulty during sleep. So I want to make sure. So when you have a convo with the patient, you get to know all these things. So now let's continue. So now let's come to the routine care. So now we have known about the patient problem. To my choice a patient problem here near man nipano ebe ka choice that day no and I will also as a nurse the assessment that you are going to make and on the patient problem. Now let's come to the routine care. So the routine care near the near man now obey I'm a patient be to say the checking of the vital signs and then the routine care now obey I'm a patient be to say the checking of the vital signs and then the routine care near man now till some and and then the routine care. So the first one we have the TPR. TPR stands for temperature pause respiration. Temperature pause respiration. In the high number you rise 4 hourly. 4 hourly nature say you check it every 4 hours. Be I check it the temperature, the pulse, and then the respiration. So when we make sure. Then when you come here, we have the BP. So the BP too, you can also write the same 4 hourly. So what you say 4 hourly. So 4 hourly means what? 4 hours intervals, and you check it. So 4 hourly. Then when you come to the diet, so the diet, say depend on when the person your man NG2 bar. So as the man depend on NG2, and I say Bia Nipano is not having any difficulties Biana. Then means a Nipano man a normal diet. So here you can write normal diet. Ebiana Udimiana food in your maniaman is animana and Nipanere Edi. So you can write normal diet. Then we have here the intake and output. So that one to be monitored. Say Nipano Niama de Kunimu, the Finimu bar. So that one is being managed. So anything everyone Adriana pass the catheter. So you get to know, say you cut it and pass the urine output then you'll be monitor all goods, So that one is also there. Then when you come here, we have the oral hygiene. So oral hygiene also then Nipano what I say to clean and say or you say so that one too you can write what monitor or done by the use of what brush and maybe paste. So we state me so truly Nipano to clean and say what. You can go out motivate twice daily. The twice daily means you will be cleaning 2 times a day. You will be cleaning with paste and brush. Then when we come here, so we have what bath and as a bath. We can bath. This is bath, whatever. And one continue away. And here too, you can also write twice daily. Twice daily with what? With towel and soap. With towel and soap. Then when you come here, you have the urine test. So if urine test B was done for the patient, say training you so like test be then you write monitored or done. Say yes then you write not done. So then when we come here, so we have the body weight. So the body weight, and also you can write 854k, and then you be a weight. You can write 100k. Did you only 100 kg? Now I tried it. Then we have the activity. So activity depends on how active the patient is, how should that one do is being monitored. So now this is the first page now and I can watch it. So the next time I will meet you are not going to talk about the first page again. You will be moving. It's about throwing together. We all will write it together. Then we get to know how to write everything. Then after that, we will use the problems in the department to write the nursing diagnosis for you. So when we come here, so we have so we have the nursing diagnosis. So here the nursing diagnosis, and I make sure say, and only a patient the problem now be can and now the try the nursing diagnosis, so nursing diagnosis, 1 year crowd there, at least you need to get 4 nursing diagnosis, solid 4 nursing diagnosis. Then when we come to the objective for the